the South African National Blood Service says it's currently experiencing a critical blood supply shortage. Now, blood stocks have dropped significantly due to the lockdown restrictions. For more on this, I'm joined by Silu Mlambo from the South African National Blood Services, and she's the spokesperson there. Ms. Mlambo, thank you so much for your time today. Now, when you, as the SANBS, say that there's blood shortage in South Africa, by how much have the donations declined?
Thank you, Thami, and good afternoon. The donations have significantly declined by about 20%. And this is because we haven't been able to go to the spaces that we usually go to collect blood, like the corporate. So most people are working from home, so we haven't been able to find them where we usually find them. And also because of the schools and the universities being closed, we just haven't been able to collect enough blood to meet the demand. And now with the country opening up a bit, so the elective surgeries are back on the table, which is why we've had a significant spike in the demand for blood donation. So when we say we need blood, particularly we're talking about Group O, and we're sitting at less than 3 days enough to meet the demand in the country.
And why is Group O the group that you are in most need of?
Usually it's the universal blood type because it can be transfused to most people, especially in emergencies. It doesn't require to be cross-matched as much, so it can be used, especially in emergencies,
Now, I do understand that because of COVID-19, you are unable to go to your traditional spaces, as you've mentioned. But what about individuals, South Africans actually coming to you to donate blood to you? How has that been going along?
It's taken quite a dip now in September because we are appealing for eligible donors to come to us, to our donor centers. But we find that convenience has always been an issue. So if we can't get to them and also they can't get to us, this is like a problem. So we are appealing to those who are eligible to reach out to us and find their nearest donor center and come and donate blood. Our donor centers are listed on the website just in case you're not sure where the nearest donor center is because you are used to donating at your workplace or at your school.
I mean, quite understandably so. There may be a level of apprehension from South Africans as far as donating blood during this time. And because it's in the midst of COVID-19, a virus that we still don't completely understand, is there reason and cause for concern?
No, absolutely not. We have adhered to all the COVID-19 precautionary measures. There is social distancing at our clinics, and where we go and collect blood, we do all the pre-screening. So it is still pretty safe to donate blood. We've always had strict protocols in any case for blood donation.
Now, what you say here is that your aim is to collect 5,000 units of blood every day nationally. Is this something that's quite attainable, and how are you going to go around doing that?
It is quite attainable. 5,000 of units means we just need about 5,000 people every day to present for donation. So over the months, we've been able to meet this target. We're just struggling at the moment. And, especially with young people, if they can come up to donate at our donor centers, we'll be able to meet this target quite comfortably.
And apart from the donor centers, you've also made a call for what you have termed here mobile blood drives. Tell us about these.
The mobile blood drives that's when we are at a shopping center near you or in a public space where, you're just driving past. So those we call the mobile blood drives. And those will be listed on our social media and also on the website if you are wondering where else to go other than our donor centers. So the shopping malls, some of them still allow us, but we really just quite challenged with the corporate and the other public spaces that we traditionally go to, like the churches. Because of the limited number of people, we haven't been able to go there because we also need to go where there is more people.
So who cannot donate blood? Who are the people on the list that you say, okay, these people should definitely not donate blood at this time?
Definitely, if you're not feeling well, if you've got some flu-like symptoms, we advise that you delay donation. And if you are under the age of 16, otherwise, if you are over the age of 16 and between 16 and 75, you can present for donation. And if you are fairly healthy, You don't have to be super healthy. If you're fairly healthy and you know that you are not on any chronic medication that would prevent you from donating, you are eligible to donate. But I always advise that people rather come to one of our clinics to find out if they can donate. You just never know.
And before I let you go, if you could just once again re-emphasize why it's important to donate blood. What is this blood used for?
Yes, the blood is used mostly for women during childbirth, and if they bleed too much, that's where most of our blood goes to actually. People think it's for car accidents or for trauma, and it's not the case. And now it's September, it's leukemia month, it goes to also cases like that, blood diseases. So it goes mostly there. And some people need daily blood transfusions just to live healthy lives. So it's very important for us to be able to save the nation.